to maybe identify some parts of the body that are more predisposed to injury, okay? The first one is to test for plantar fascia irritation or maybe a little bit of plantar fasciitis. If you have plantar fascia pain, you're most likely, pretend this is my foot, you're most likely going to feel pain somewhere along the inside bottom of your foot, usually right at the base of the heel. And that can be present when you're walking, running, even just sitting still. So to test for that, I'm going to stand flat, make sure I have weight on my feet, and I'm going to pick up the big toe of the foot that hurts, okay? And if picking up that toe exacerbates the pain I'm feeling on the bottom of my foot, it's most likely plantar fascia pain. If you don't have any pain normally, but you have some discomfort when you pull that toe up, then it's likely you have a little bit of irritation that may get worse if you continue running or walking the way you're doing now. The second test is called Trendelenburg. I know that's a big word. What all that means is when you stand on one leg, we want to see what your hips do. So if you demonstrate a Trendelenburg stance, that means that one hip sags lower than the other, okay? And so if I stand like this on one leg with this hip sticking out, it means the hip muscles on the side of this leg that I'm standing on are weak. You should be able to hold your hips nice and level, okay? So anyone can hold for about 10 seconds. That's not too hard. But try standing on one leg and holding for about a minute, okay? You should be able to use these hip muscles and keep your hips up nice and level. On that note, if you find yourself walking and every time you take a step, your hip sticks out to the side, then it indicates some hip weakness right there on the outside, okay? So anytime you're walking, running, or even standing, if you can't keep your hips level, that can indicate some lateral hip weakness, okay? And the very last test is quite unique. I call it the water footprint. And we're gonna use it just as a rough test to look at the arches on our feet, okay? We can look at how high they are or how low they are, and then we can even compare them to each other. So we're gonna use water to do that, okay? So the first thing I'm gonna do, I'm gonna carefully dip my foot in some water, shake it off so it doesn't make a big mess, and then I'm gonna step down so I can see what my foot looks like. And then I'm gonna do the same thing on the other side, dip, shake it off. Let me try that one more time. Dip, shake it off, and stand. Good. So I can see what my feet look like. You'll notice that right here, I don't have any water, and the same thing on this side. So that means my arches are up pretty high. And then I can also tell that my arches are pretty level, right? Or compared to each other. If this foot had a lot of water on the ground, but this one not much, I would know that maybe my right one has fallen a little bit. My left is pretty good. So if you step on the ground with water on your feet, and you notice that this whole area right here is just full of water, and your foot just kind of looks like an oval-shaped footprint, then it's quite possible that your arches have fallen. And like I talked about in the video, or in the presentation before, if your arches have fallen, you're more predisposed to pronate at your feet, and then that can possibly lead to some knee and hip pain too, right? So this is a rough test. If I was doing this seriously, I would probably do it 2 or 3 more times just to check my accuracy, but it's something you can consider doing at home for yourself. So like I said, we have those 3 special tests that we can use to help identify an injury or maybe the likelihood of experiencing an injury in the future.